Imagine this quiet anticipation, a mare nearing the end of her pregnancy. It's usually a time for careful watching, sort of calm before the storm.
Right.
But what if just suddenly there are signs of intense, really unusual discomfort? What kind of hidden critical emergency could be unfolding inside?
It's a scenario no owner or veterinarian really wants to face, yeah.
Hmm.
A sudden shift from, like, hopeful waiting to urgent concern.
Absolutely. And that sudden shift, well, that brings us to the focus of this deep dive: equine uterine torsion. It's uncommon, yes, but undeniably life-threatening, an obstetric emergency.
Exactly. And for you, the curious learner listening in, our mission today is really to untangle the complexities of this condition. We'll look
Mhm.
at, what it is, potential causes, how vets diagnose it.
The treatment options, too, which are crucial.
Right, the treatments, what to expect for the mare and the foal, and even some recent advancements in veterinary science.
Our goal is to give you a clear, comprehensive understanding of this vital topic, quickly and thoroughly. So let's unpack this challenging situation.
Let's do it.
Okay, so to start, what exactly is equine uterine torsion? It sounds pretty dramatic.
It certainly is dramatic. At its core, equine uterine torsion is the rotation, or you could say twisting, of the pregnant uterus along its longitudinal axis.
Okay.
Think of it like a full sack, maybe, that suddenly gets spun around its middle.
And when does this typically happen in a mare's pregnancy? Is there a specific window?
Yeah, it usually occurs during mid to late gestation. Most often you see it in the last 3 months, so say between 8 and 11 months. Though, honestly, it's frequently observed a bit earlier, too, maybe 6 to 9 months.
So relatively uncommon overall, but it accounts for what, maybe 5 to 10% of all equine obstetric emergencies? That's significant.
It is significant when it happens, yes.
Is there something unique about how it happens in mares, like where the twist occurs?
That's actually a key distinction. In some other species, the twist might involve the cervix or even the vagina. But in mares, it's almost always just the uterine body itself.
Interesting.
And the rotation itself, well, it can range from a relatively mild 90 degrees up to over 360 degrees, a full twist or more. Though, 180-degree rotations are pretty commonly seen.
Clockwise or counterclockwise? Doesn't matter?
It could be either, yeah, clockwise or counterclockwise.
Yeah.
Um, there's some suggestion that counterclockwise torsions might be slightly more common in mares.
Okay, so we understand the what of this twist. The next big question, and maybe even more perplexing, is why it happens. What causes it?
Right, and here's where it gets really interesting. The exact causes. They remain largely unknown.
Really? Still?
Still, which is fascinating, isn't it? It highlights that there are still these profound mysteries, even in relatively, well, common animal conditions. It forces vets to rely heavily on just keen observation and rapid response.
So what are some of the suggested factors then? The theories?
Well, vigorous fetal movement is one idea.
Mhm.
If the foal suddenly makes a really strong move inside, it could maybe initiate a twist.
Makes sense.
Also, the mare's own physical movements are considered, like if she rolls energetically or has a sudden fall.
Ah, like her body turns faster than the uterus can follow.
Precisely. The uterus lags behind and twists. Then there are fetal characteristics, potentially, maybe a very large fetus compared to the amount of fluid, or a fetus in an abnormal position.
Okay. What about the mare's anatomy itself?
That's another factor. Things like a lack of tone in the pregnant uterus, or maybe an abnormally long, broad ligament that's the tissue suspending the uterus, or just, an inadequate suspension overall. It could provide a bit too much leeway for the uterus to twist on itself.
And could that ligament stretching happen over time with multiple pregnancies?
Yes, that's thought to be a possibility. That repeated stretching during previous pregnancies might lengthen those ligaments, which leads into your next likely question.
Are mares that have had foals before more at risk?
They are, generally. It's more commonly observed in what we call multiparous mares, those with multiple previous pregnancies. Though, importantly, it can affect first-time mothers, primipary too.
Any other physical traits?
Possibly mares with a particularly large, deep abdomen might have a slightly greater predisposition.
Wow, that's a lot of potential factors, but like you said, no single definitive cause. That's surprising.
It is, and it's also counterintuitive in a way. You might think a large animal like a horse would be more susceptible. But actually, mares are thought to be less prone to uterine torsion compared to, say, cows.
Why is that?
It's possibly due to the mare's more stable anatomical setup, how their reproductive tract is suspended, with sublumbar ovarian attachments and these dorsally attached broad ligaments. seems to offer a bit more stability.
A surprising layer of protection.
Exactly. And genetics. Well, while there's no definitively recognized hereditary link, there are theories. Like if the length of those broad ligaments had a genetic component, maybe that could contribute to a predisposition in some lines. But it's still theoretical.
Okay, so given that the exact cause is often a mystery, recognizing the signs becomes absolutely critical. What should an owner or a vet be looking for?
Right. The primary sign, the most common one, is abdominal pain, colic.
Okay, standard colic signs.
Yes. But the key here is that the pain can be mild to moderate. It might come and go, so it's intermittent. And often this is a big red flag. It shows a poor or maybe only a temporary response to standard pain medications.
Ah, so if a mare seems uncomfortable again shortly after getting a painkiller, that's a clue.
Definitely a clue to investigate further.
Yeah.
Other acute signs you might see: restlessness, pawing at the ground, looking back at their flanks, sweating.
Usual suspects for discomfort.
Right. Inappetence, maybe frequent urination. Sometimes they adopt this distinctive sawhorse stance, legs braced, back arched, kicking at the abdomen, even rolling. And then systemic signs like lethargy, anxiety, an elevated heart rate, tachycardia.
That sounds an awful lot like a mare getting ready to foal, especially if she's getting close to her due date.
It absolutely can, and that's a critical point for owners. The restlessness, the sweating, it might initially be mistaken for the onset of normal labor.
So timing and context are key.
Very key. And the severity of all these signs, it's usually directly related to how much the uterus is rotated and, crucially, how much the blood supply is being impaired by that twist.
Is it always this acute, sudden thing, or can it sometimes be more subtle, a slower onset?
Good question. Yes, in rarer cases, uterine torsion can actually present as more of a chronic disorder. You might see just vague signs appearing over days, maybe even weeks or months before it's diagnosed.
Like what kind of signs?
Things like a low-grade fever, maybe some anemia showing up on blood work, anorexia, not wanting to eat, and just general depression or lethargy.
And what if other organs get involved, like the intestines?
If the gastrointestinal tract gets involved concurrently, maybe trapped or compromised by the twist, then the mares might show more severe signs. Things like reflux coming up the nasogastric tube, absent gut sounds, very little manure production.
That sounds really serious. What about when a mare is actually at term and the torsion physically stops labor?
That's a very dangerous situation. If the mare is at term, she might fail to show the normal signs of progressing labor, like the Ferguson's reflex, which triggers pushing.
Why?
Because the fetus simply cannot enter the pelvic canal and the cervix because of the twist. And the awful part is, this can lead to fetal death without the owner even realizing that labor should have started.
Oh, wow. Okay. So the signs can be varied and sometimes misleading. How do veterinarians actually confirm the twist then? What's in their diagnostic toolkit?
Well, the first step is always taking a good clinical history and doing a thorough physical exam. A history of colic signs in a pregnant mare, especially in that third trimester, should immediately make you suspicious.
Right.
But the most essential, the primary diagnostic method, is transrectal palpation, TRP.
Going in rectally to feel the uterus, how does that help identify the torsions specifically?
So the veterinarian palpates the broad ligaments, those supportive bands. In a normal pregnant mare, they run sort of front to back, longitudinally. With uterine torsion, one or both of those ligaments will feel palpably tight, taut, and they'll be coursing transversely, side to side across the abdomen. That tension and direction clearly indicates the torsion. Its direction clockwise or counterclockwise, and often gives an idea of the degree of twist.
So it's not just feeling the uterus itself, but those supporting ligaments.
Feeling those ligaments is key, and that palpation is also crucial for ruling out other causes of colic, like an intestinal issue, or confirming it's not just normal labor presenting unusually.
Okay, so rectal palpation is the gold standard here. What about imaging? Does ultrasound play a role?
Absolutely. Transabdominal ultrasonography is a really valuable tool. It helps assess critical details like, is the fetus still viable? Checking for a heartbeat. What's the integrity of the uterine wall like? Are there signs of swelling, edema, hemorrhage, or even tissue death, necrosis? Any signs of the placenta separating?
That gives a lot more information.
It does, and Doppler ultrasonography can go even further, evaluating the actual blood flow within the uterine vessels. That's vital for assessing how compromised things are.
What about a vaginal exam? Is that helpful?
Usually not for diagnosis before labor starts, because the cervix is typically closed and tightly sealed during late pregnancy. It might only be attempted if the mare is actually at term and the cervix has started to open, which could potentially allow some manual assessment, but it's not a primary diagnostic tool for the torsion itself.
Okay. And blood tests. You mentioned anemia earlier. Do they offer specific diagnostic clues for torsion?
Not directly diagnostic for the torsion itself, no. But lab tests like a CBC and serum biochemistry are important. They can reveal systemic complications. Things like anemia, yes, or changes in white blood cell counts indicating inflammation or infection, elevated lactate levels suggesting poor tissue perfusion, increased inflammatory markers.
Like SAA?
Exactly, serum amyloid A or haptoglobin. And in prolonged cases, you might see markers of organ damage like elevated BUN or AST. Monitoring hormone levels, specifically serum progesterone and estradiol, might also offer some prognostic clues. Falling estradiol levels, for instance, can indicate fetal distress or even impending fetal death.
Right, so the blood work helps assess the overall health of the mare and foal and the severity, rather than diagnosing the twist itself.
Precisely. It paints a fuller picture of the systemic impact. It's a thorough investigative process to figure out exactly what's happening inside.
Okay, so once this critical diagnosis is confirmed, the clock really starts ticking, doesn't it? What are the immediate steps? What treatment pathways are available to untwist that uterus?
Yeah, time is absolutely of the essence. Immediate intervention and correction are recommended as soon as uterine torsion is diagnosed. It's crucial for optimizing the outcome for both the mare and the foal.
No waiting around. Okay, what's the first line of defense, typically? Is surgery always needed?
Not always. Generally, if possible, non-surgical correction, often called rolling the mare, is preferred.
Rolling.
Yes. This is especially considered in, let's say, earlier cases when the direction of the twist is known, when there's no suspicion that the gut is trapped or that the uterus might have ruptured. When the rotation isn't too severe, usually less than 360 degrees, and importantly, when the mare isn't right at term yet. So typically under about 9 months of gestation.
Why is it preferred then?
Well, it's more economical, for one, and it avoids the risks associated with major abdominal surgery and general anesthesia.
That makes sense. It sounds like a fascinating procedure, though. How does rolling actually work?
It is pretty interesting. The mare is sedated first and then put under general anesthesia. She needs to be fully relaxed. Then she's carefully positioned, lying on her side, what we call lateral recumbency, specifically on the side towards which the uterus is rotated.
Okay, so if it's a clockwise twist, she lies on her right side.
Exactly. Then, a crucial step. Someone positions a sturdy wooden plank across her flank, applying pressure to help stabilize the uterus, to keep it from just rolling with her body.
Holding the uterus in place.
Right. Then, with several people assisting it takes a team. The mare is rolled fairly rapidly, usually through being on her back, into the opposite lateral recumbency, all while the person with the plank maintains pressure to keep the uterus relatively fixed.
So the mare's body essentially rotates around the stabilized, twisted uterus.
That's the goal, precisely.
Yeah.
The body rotates, the uterus stays put, and hopefully it untwists. Using ropes on the mare's legs is usually advised for safety during the roll.
Are there risks with this method?
Yes, especially as the mare gets closer to term. The uterus is heavier, more fragile. There's an increased risk of rupturing a uterine artery or even tearing the uterine wall itself. So timing matters.
How do you know if it worked?
After the roll, the vet confirms via transrectal palpation, checking those broad ligaments again. And sometimes multiple attempts, multiple rolls might be necessary. But when successful in the right cases, this technique actually has reported high success rates with relatively low complication rates.
Okay, but what happens if rolling isn't successful? Or if it's just not considered safe for that particular mare? Does that mean surgery is the next step?
Yes, exactly. Surgical correction becomes the indicated approach when rolling fails, or if there's already a strong suspicion of uterine rupture or significant gastrointestinal involvement, or simply if the mare is right at term, but her cervix is still closed, preventing natural birth.
Yeah, and what are the surgical options?
There are a couple of main surgical approaches used.
Let's hear about them.
Okay, the first one is called a standing flank laparotomy, SFL.
Done while the mare is standing.
Yes. This is most commonly recommended for mares that are relatively calm, tractable, and where there isn't strong evidence of uterine rupture already. The incision is made in her flank, typically on the side towards which the uterus is twisted. Or sometimes a left flank incision is standard if the direction isn't certain.
And how is the correction done?
It's performed with the mare standing, yes, heavily sedated, and with local anesthesia blocking the incision area. The surgeon then reaches into the abdomen through that flank incision and manually corrects the torsion. They might sort of rock the uterus back and forth to gain momentum, or sometimes gently grasp the foal's back legs, the hocks, and use that to rotate the fetus and the uterus back into position.
Can they check for damage this way too?
Yes. A key advantage is that this approach allows the surgeon to manually explore the uterus, feeling for tears, checking for significant hemorrhage, swelling, or signs of tissue death.
What are the pros and cons compared to, say, surgery under general anesthesia?
The big pro is avoiding general anesthesia, which always carries risks, especially in a heavily pregnant mare. It's less invasive overall. The downsides? Well, visibility is limited. You're working mostly by feel. It can be physically difficult for the surgeon with very severe torsions or in particularly large mares, and you really can't easily address a major uterine rupture or significant GI complications through a flank approach.
Okay. So, when would the other major approach, likely under general anesthesia, be preferred?
That would be the ventral midline celiotomy, or VMC. This is the preferred approach for those more severe or chronic torsions, definitely when rolling has failed, or if uterine rupture or concurrent gut problems are strongly suspected. Also, if a cesarean section is likely needed anyway.
And how is that performed?
That's done under full general anesthesia with the mare positioned on her back in dorsal recumbency. A surgical incision is made along the ventral midline, the underside of her abdomen.
What's the advantage of that approach?
It provides excellent, rapid, and much clearer surgical access to the entire abdominal cavity. The surgeon can directly see the uterus, thoroughly assess its viability, looking visually for tears, hemorrhage, edema, necrosis, congestion, and then manually detorse it. They can also easily assess and address any concurrent gastrointestinal problems at the same time.
More versatile, then.
Much more versatile. And if necessary, a hysterotomy, that's the C-section incision into the uterus, or even, in dire circumstances, the hysterectomy, removal of the uterus, can be performed through this approach. One study actually showed good success with VMC in maintaining the pregnancy afterward and delivering viable foals, something like 86.6% success in that group.
But it comes with higher risks, I assume.
The main trade-offs are the need for general anesthesia, which has inherent risks for both the mare and the fetus, and the fact that it's simply a more invasive surgery with potentially a longer recovery.
What about a C-section itself? Is that often done because of the torsion?
It can be performed, yes. However, interestingly, correcting the torsion before making the incision into the uterus often makes it easier to actually extract the fetus and then suture the uterine incision closed. So a C-section is usually only performed right away if the fetus is at term and delivery needs to happen immediately. Or perhaps if the fetus is already confirmed, non-viable, and vaginal delivery isn't possible. Remember, most torsions actually occur before the natural onset of labor.
Right, that makes sense. So regardless of the method used to untwist rolling or surgery, what kind of supportive care is needed afterwards?
Supportive care is absolutely crucial, no matter how the correction was achieved. This typically includes intravenous fluids like Ringer's lactate to combat dehydration and shock. Prophylactic antibiotics are usually given, especially after surgery, to prevent infection.
And pain management.
Definitely. NSAIDs, nonsteroidal anti-inflammatory drugs like Slunix and Maglumin, are essential for managing pain and inflammation. Then, post-delivery, if the foal was delivered during the procedure or shortly after, oxytocin might be administered to help the uterus contract back down, involute, and also to aid in expelling the placenta.
Okay, so once the mare is treated, what's the outlook? What's the prognosis realistically for the mare and for the foal? And what potential complications are they facing?
Yeah, it's important to be realistic. Uterine torsion remains a significant emergency for both lives involved, but early diagnosis and immediate intervention are absolutely key to improving those survival rates.
So what are the mare's chances, generally speaking?
For the mare herself, the survival prognosis is generally considered good to excellent. Reported rates range quite widely, but often from 60% up to over 95% in some studies.
That's quite high, thankfully. Does the timing within the pregnancy matter?
It seems to. Mares treated earlier, say before 320 days of gestation, tend to have a higher survival rate, maybe up to 97%, compared to those treated right at or beyond 320 days, where it might drop to around 65%.
Why the difference?
It's likely due to the increased size and weight of the near-term fetus, making the correction more difficult and potentially causing more trauma or vascular compromise. But the good news is that most mares that survive the torsion event and recover well are usually sound for future breeding.
That is good news. What about the foal's chances?
The full survival rate is much more variable. It can range anywhere from as low as 30% up to, again, over 95% in some scenarios.
What influences the foal's outcome so much?
It's directly linked to the gestational age when the torsion occurred, and critically, the duration of the torsion and any resulting dystocia or difficult birth. How long was the blood supply compromised? How stressed was the foal? Early correction is just vital for fetal viability.
Makes sense. Now, what about the potential complications? I imagine they can be quite severe.
There certainly can be. Focusing on the uterus first, the most feared complication is uterine rupture. This can happen due to prolonged ischemia, lack of blood flow, leading to tissue death, or sometimes even during the manual correction attempts. It's a severe, potentially fatal complication.
Because of infection.
Exactly. Massive contamination of the abdominal cavity leading to peritonitis. Other uterine issues can include localized tissue death, uterine necrosis, or significant hemorrhage due to that impaired blood supply, even if it doesn't fully rupture.
And can other body systems be affected? You mentioned the gut earlier.
Yes, absolutely. Concurrent intestinal problems are a real risk. Things like obstruction, actual entrapment of a loop of bowel, often the small colon, or ischemia, lack of blood flow to the gut, even just gas distension or tympany.
What about systemic issues for the mare beyond the uterus and gut?
Well, peritonitis, as we mentioned, if rupture occurs. There are also potential postoperative complications after surgery, like fluid pockets under the skin, seromas, or muscle damage related to the anesthesia, post-anesthetic myopathy, and believe it or not, even laminitis is a potential secondary complication in stressed mares.
Laminitis too. Wow. And after foaling, assuming the mare delivers.
Post-foaling complications can include retained placenta, metritis, which is a uterine infection, septicemia, that's a widespread bacterial infection in the bloodstream. And potentially there can be issues with future fertility, although, as I said, many mares do successfully breed back after recovery.
Then the worst outcome for the foal
Is, of course, a non-viable fetus delivered or fetal death occurring before intervention is possible.
So wrapping up the prognosis factors, what really tells a vet how good or bad the outlook might be in a specific case?
The degree of rotation, and especially the duration of the torsion, are critical. The longer the uterus has been twisted, the more severe the vascular impairment is likely to be. This directly increases the risk of uterine necrosis, rupture, and ultimately fetal demise.
Are there markers for that duration?
Prolonged torsion is often associated with those increased inflammatory markers we talked about, SAA, haptoglobin, and indicators of organ damage like DUN and AST. Also, those decreased estradiol levels can be a sign. And obviously, the fetal viability at the time of presentation and whether other complications like gut issues are already present significantly influence the overall prognosis.
So much really depends on how quickly it's caught and how quickly it's addressed.
Absolutely, speed is critical.
Okay, this is clearly a complex and serious condition. Given that, can we actually do anything to prevent equine uterine torsion? Are there specific management strategies owners should know about?
That's a really crucial question, isn't it? But unfortunately, given that the exact causes are still not definitively known, specific preventative measures are quite challenging. There's no vaccine or single management change that guarantees prevention.
Right, so it's less about a specific prophylactic measure and more about just being watchful.
Exactly. What becomes paramount is really careful management and intense vigilance during late gestation. Owners, farm managers, veterinarians, everyone needs to closely monitor pregnant mares, especially in that third trimester. Look for any signs of discomfort or colic, no matter how subtle, or just any changes in the mare's normal demeanor or behavior.
And act fast if something seems off.
Act fast. Prompt veterinary intervention is the single most critical factor in improving the outcome for both the mare and the foal. And as we discussed, transrectal palpation should really be considered mandatory in any pregnant mare showing signs of colic.
So basically, if a pregnant mare is colicking late in gestation, assume it could be torsion until proven otherwise by a vet.
That's a very safe and sensible guideline for assessment. Yes, treat it with suspicion. Now, regarding the mare's own activity, we talked about controlled rolling as a treatment. What about uncontrolled rolling by the mare herself, like if she's colicking? Could that cause it? It's theoretically possible, yes. That excessive rolling during a colic episode could contribute to a torsion, but honestly, it's not definitively proven as a primary cause. And interestingly, limiting a mare's normal, rigorous exercise during pregnancy is generally not indicated or warranted. In fact, Some believe it might even lead to an increase in difficult deliveries later.
Oh, interesting. Okay. What about diet? Does that play any role?
Possibly indirectly. Permitting access to free choice hay is generally advisable. Keeping the digestive tract full and functioning well might help reduce the incidence of other types of abdominal colic, which could potentially complicate the picture or maybe even trigger excessive rolling.
Okay. And what about after a torsion has been successfully corrected? What management is needed then?
Ah, post-correction care is very important. Generally, strict stall rest for the mare is recommended, maybe just gentle hand walking until she foals if possible. The goal is to prevent vigorous activity like running or, importantly, having the opportunity to roll again before the uterus is fully settled.
Any medications?
Sometimes progesterone supplementation might be given for a week or two. The idea is it might help maintain good cervical tone and potentially prevent any ascending contamination or infection, especially if the cervix was manipulated.
Does it tend to happen again? Like in the same pregnancy or future ones?
Good question. Recurrence of the condition after successful correction and delivery hasn't really been reported for mares that were treated at term and were in labor. So once corrected and foaled out, the immediate risk seems to pass for that pregnancy. Future risk isn't necessarily zero, but it's not considered a high recurrence issue typically.
That's somewhat reassuring. Okay, shifting gears slightly. What's happening on the research front? Are there cutting-edge developments? Are vets finding new ways to diagnose or treat this condition?
Yes, there's ongoing work. In terms of advanced imaging, for instance, continued advances in ultrasonography are helping, especially Doppler modalities, color Doppler, power Doppler, spectral Doppler. These allow for a much more detailed assessment of uterine and placental blood vessel health, the vascularization.
Giving a better idea of tissue viability.
Exactly. Better insights into fetal viability and the integrity of the uterine wall. There's even some exploration into computer-assisted pixel analysis of ultrasound images, trying to get more objective, semi-quantitative evaluations.
So creating more precise internal maps, essentially.
Kind of, yeah. And related to prognosis, researchers are looking more closely at those prognostic biomarkers we touched on. Studies are investigating the real utility of tracking serum progesterone, and especially estradiol concentrations after correction. As we noted, declining estradiol might be a useful flag for fetal compromise.
Helping monitor recovery and fetal status after treatment.
Right. It helps refine our understanding of how the mare and foal are doing post-intervention.
And what about understanding the underlying why? The pathophysiology. Any breakthroughs there?
There's interesting research looking into inflammatory changes within the blood vessels of the uterine wall itself. These alterations seem to increase with the mare's age and the number of pregnancies she's had, her parity.
Could that make the uterus more prone to twisting?
It might provide a better understanding of factors that could predispose the uterus to fragility or perhaps impaired function, making it less able to withstand certain forces. But their direct role in actually causing the torsion itself is still being worked out, still being elucidated.
And on the treatment side, refining techniques.
Definitely. Ongoing research continues to refine surgical techniques. There's particular interest in comparing the outcomes and complications between the standing flank laparotomy versus the ventral midline celiotomy, which approach is best under which circumstances. And also, every time veterinarians publish case reports of unusual or atypical presentations of torsion, that adds to the collective knowledge base, helping other vets recognize the more varied forms this condition can take.
It's really incredible how much ongoing work goes into understanding and managing these rare but absolutely critical conditions.
It really is. Continuous learning and refinement.
Well, we've just taken quite a deep dive into equine uterine torsion. We've uncovered its, well, surprising mechanics, the critical clues it presents, those urgent and often innovative treatments, and the really complex factors that influence recovery for both mare and foal.
Yeah, I think what really stands out is how such a seemingly subtle internal event, just a twist, can create such a profound and immediate emergency.
And how veterinary ingenuity is constantly evolving, finding ways to intervene and hopefully save both lives.
Absolutely. This deep dive, I think, it really reveals the incredible resilience we see in animals, but also highlights the crucial role of advanced veterinary care. Kind of makes you wonder, doesn't it, what other rare internal conditions, maybe in different species across the animal kingdom, are being quietly diagnosed and tackled by dedicated experts right now, experts who are constantly pushing the boundaries of our understanding of life itself.
It's a vast world of discovery out there, for sure. A really fascinating thought. So keep your curiosity piqued. Keep exploring the remarkable world of veterinary science. Every new discovery, every refined technique helps ensure the health and well-being of the animals we share our lives with and cherish.